We want to take you right now to Capitol Hill, where the Senate is questioning the director of the CDC, that is her, Dr. Rochelle Walensky, concerning the COVID response. Let's listen in.
Vaccines should quarantine for 5 days if they come in contact with someone with COVID-19. People who do not develop symptoms by day 5 should get tested. If you test positive, you should begin isolation. People who test negative may end quarantine and should continue to wear a well-fitting mask when around others for an additional 5 days. These recommendations are consistent with over 100 studies collected over the past 2 years, indicating that people are most infectious during their first few days of infection and significantly less infectious 6 to 10 days after infection. A core part of CDC's mission is to translate science into recommendations for best practices and real-world circumstances. Over the holidays, we saw the growing surge of Omicron and took swift, science-based action to address the very real possibility of staffing shortages in hospitals and in other essential areas of the workforce, including schools, pharmacies, public safety, public labs, grocery stores, and other sites, where shortages could have and have proven to have dire public health consequences. This is the right guidance for what we currently know about transmission and the real-world circumstances we currently face. As we will learn more, we will continue to update accordingly. Omicron is likely not to be the last curveball this virus throws at us, but we have the tools to prevent further spread of this virus. This means for everyone 5 and older, please get vaccinated. For those 12 and older, get your booster shot. And please continue to adhere to the multi-layered prevention measures, including masking and, yes, washing your hands. Thank you, and I look forward to your questions.
Thank you. Dr. Fauci.
Madam Chair, Ranking Member Burr, members of the committee, thank you for giving me the opportunity to discuss with you the role of the National Institute of Allergy and Infectious Diseases in the conduct and support of research addressing our nation's response to COVID-19. In our most recent hearing before this committee on November the 4th, I discussed the importance of booster shots to enhance immunity against the Delta variant that wanes over time. Indeed, booster shots have dramatically reconstituted the waning immunity and has increased protection over and above the original level afforded by the primary vaccine regimen. Today, we are faced with a different challenge, a new variant called Omicron that has rapidly spread throughout the world, including a massive, unprecedented surge in the United States. This variant possesses a large number of mutations that are associated with an increased efficiency of transmission, immune evasion from certain monoclonal antibodies, convalescent plasma, and antibodies induced by our current vaccines. Thus far, data from our own laboratories at NIAID, as well as from laboratories throughout the world, have indicated that vaccine-induced antibodies lose a considerable amount of potency in neutralizing the Omicron variant. Although this is of obvious concern, the encouraging news is that a third shot boost of an mRNA vaccine significantly reconstitutes and enhances the ability of antibodies from boosted individuals to neutralize the Omicron variant, strongly suggesting that boosters will play a major role in protecting our population, at least from severe disease, in the context of the ongoing massive surge of the Omicron variant that we are currently experiencing, underscoring why it is so important for the unvaccinated to get vaccinated and for those who are already vaccinated to obtain the booster shot. Therapies in general are an important part of our armamentarium against COVID. In this regard, the NIH has been heavily involved in the development and/or clinical testing of several effective monoclonal antibodies against SARS-CoV-2. However, we have ascertained that certain of the authorized monoclonal antibodies are negatively impacted by the Omicron variant. Direct antiviral therapies also are an extremely important tool in the fight against COVID-19. Importantly, it appears that the mutations expressed by the Omicron variant do not interfere with the oral antiviral drugs Paxlovid and Molnupiravir that NIH-funded investigators played an early role in developing and that have recently received emergency use authorization from the FDA. Nor do they appear to interfere with the FDA fully approved drug remdesivir, shown by NIH-sponsored studies to be highly effective in preventing severe disease. Looking ahead in the context of the inevitable continual emergence of new variants, the importance of developing a pan-coronavirus vaccine, namely one that would be effective against all SARS-CoV-2 variants and ultimately against all coronaviruses, becomes even more apparent. My colleagues and I recently published a paper in the New England Journal of Medicine emphasizing the urgent need for such an effort. In this regard, we have made significant progress in that direction. We have identified antibodies that neutralize multiple different coronaviruses, and in addition, NIAID has issued new awards to fund pan-coronavirus vaccines at 4 academic institutions. These awards will fund multidisciplinary collaborative teams to conduct research focused on coronavirus virology and immunology, immunogen design, and innovative vaccine and adjuvant platforms, as well as technologies to discover, design, and develop pan-coronavirus vaccine candidates. Finally, I would like to close by looking forward to how we might best enhance our preparedness for what inevitably will be the emergence of future pandemics. The NIAID will play an important role in the multi-billion-dollar all-of-government plan for pandemic preparedness. Our mission is the rapid development and implementation of successful countermeasures against several prototype pathogen families of viruses that threaten the health and safety not only of our nation, but of the entire world. Thank you for your attention, and I would be happy to answer your questions following the presentations.
Thank you.
Dr. Anthony Fauci speaking there before a Senate committee. Before that, Dr. Rochelle Walensky. Dr. Fauci making news just moments ago indicating that because of the emergence of Omicron, the variant that seems to be so highly infectious across the U.S., they are now looking at a treatment that would treat all emerging variants at the same time, which would eliminate the need for Americans to have so many different booster shots. All of this coming at a time when COVID hospitalizations are reaching another record high. 132,646 people hospitalized. That surpassed the record set in January of last year. That surge caused by Omicron, that, as we have been reporting, has been putting a massive strain on health systems in several states. We will continue to follow this story.